I present a poster about the first reported case of VOD, that is veno-occlusive disease, presenting after CAR-T cell infusion and not after hematopoietic stem cell transplantation, that is the usual setting in which these cases arises. It's a case of a 12-year-old girl affected by CD19 positive acute lymphoblastic leukemia who was infused by Kymriah. And after this infusion, many complications ensued, and one of these was this hepatic involvement. She met 3 out of 5 criteria of the EBMT pediatric criteria of VOD. Indeed, she had an increase in her weight above 5% of her baseline, and also she had increase in bilirubin, more than 5 mg/dL within 72 hours, and ascites on abdominal ultrasound imaging. That's why we chose to treat her by defibrotide, 25 mg/kg from day 4 to day 18, with complete resolution of this syndrome. And as we already know, the endothelium is one of the crucial points after innovative therapies such as CAR-T cell therapies, but also after hematopoietic stem cell transplantation. Indeed, many inflammatory mediators or several kind of injurious stimuli can damage the endothelium. The first thing is that the endothelium activates itself, then usually this activation could lead to an irreversible endothelial damage. And usually this is the initiating event in the cascade of pathophysiology of different kind of complication. As we already have known in transplant setting, the endothelium involvement is on the basis of VOD that we already mentioned, but also GVHD, graft-versus-host disease, TA-TMA, transplant-associated thrombotic microangiopathy. But focusing on CAR-T patient, we also know today that endothelium is on the basis of CRS, cytokine release syndrome, and also ICANS, immune effector cell-associated neurotoxicity syndrome. Indeed, patients presenting with CRS have a very increase in inflammatory markers, and they also show an increase in marker of endothelial damage, especially if they have CRS grade 3 or 4. And for ICANS, is quite different, the situation, because we, first of all, today, so far, we don't even know completely the pathophysiology of ICANS. But what we have observed is that the CRS itself is present and is of high grade, and the lymphodepleting agent that we use, or also the CAR-T themselves for their activation and for their expansion, could trigger or exacerbate endothelial damage. And so this leads to a breakdown in blood barrier, sorry for that, and an influx of cytokines in the central nervous system. And that's why I think it's very important and crucial to understand the pathophysiology of this underlying mechanism, because this could give us the opportunity to treat better our patient and to have the possibility to treat with safe and effective treatment our patient. And what the case I presented adds is that there are several forms of endothelial involvement. Probably we don't know already each of the forms that we can have after CAR-T cell infusion, and VOD, it's the first time that we report VOD after CAR-T cell. So we should pursue the aim to learn more about this complication and to investigate this complication. And this case also ushers the debate about the opportunity to protect the endothelium before this complication arise.